Hi everyone, today we're talking about one of the most feared viruses on the planet. It's the Ebola virus. Now I know you've probably heard about it, you probably definitely have heard about it in the news, but what is it? How does it spread? And is there anything we can do about it? I'm also going to talk about symptoms as well. I'm Dr. Jen Caudle. Ebola virus disease is a severe and often deadly illness caused by the Ebola virus. It was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of the Congo, when two outbreaks struck at the same time, one in Congo and one in Sudan. Now, the virus belongs to a family called Filoviridae. Under a microscope, it looks like a long thread-like filament, which is actually where the family gets its name. And there are 4 types of Ebola virus known to cause disease in people. The Zaire species is probably the most common and the most deadly. So how do people catch Ebola in the first place? Well, it starts in the animal world. So fruit bats are believed to be the natural reservoir, meaning they carry the virus without getting sick, and then humans can get infected through contact with infected animals like bats or primates, often through hunting or handling bushmeat. Once a person is infected, the virus can then spread from human to human, but only through direct contact with the body fluids of someone who is already sick. That means blood, vomit, diarrhea, saliva, sweat, even breast milk. It can also spread through contaminated objects like needles or bedding. Now, something important to note is that a person with Ebola is not contagious during the incubation period, only after symptoms appear. And just so that you're reassured, Ebola does not spread through the air like COVID, as an example. You really have to have direct contact with an infected person's bodily fluids. After being exposed, it takes anywhere from 2 to 21 days for symptoms to actually appear, with most people getting sick around 6 to 10 days after infection. And this is where things get tough. It starts with things that we call dry symptoms, things like fever, headache, muscle aches, fatigue. Honestly, how many times have you heard those symptoms happening at the beginning of an illness? And you're right, the same ones are here. Those sound kind of like flu-like symptoms. It's one of the things that can make this diagnosis tricky, especially in the beginning. Then, often around day 4 or 5, the wet symptoms kick in. This is nausea, this is vomiting, and severe diarrhea. The fluid loss can be extreme, up to 10 liters per day in some cases. This is one of the big problems with this condition. It can lead to dangerous dehydration. And then in severe cases, people can develop bleeding. We're talking bleeding from the gums, from needle sticks, or even the stool. In fact, we used to call it Ebola hemorrhagic fever, but in truth, the bleeding actually occurs in fewer than half of the patients. But still, that's a lot. And it's potentially very deadly. And also the dehydration, the organ failure, the shock that can occur along with the fluid loss, etc. People with fatal cases typically die within 7 to 10 days of symptom onset from multi-organ failure. This is an absolutely devastating disease. Ebola is one of the deadliest infectious diseases known. The average case fatality rate across all outbreaks is around 50 to 60%. But it has ranged from 25% to as high as 90%, depending on the outbreak and the virus strain. Do you remember back in 2014? I remember that time. We actually had the largest outbreak in history. It hit West Africa from 2014 to 2016. Over 28,000 people were infected, more than 11,000 died. It really devastated communities and overwhelmed healthcare systems in Guinea, Sierra Leone, Liberia. So let's talk about treatment and also talk about prevention. And this is where it gets really important to understand that not all Ebola strains are treated the same way, not all of them are equal, and that we do have different strains. So first, the good news is that there are things doctors can do for any strain of Ebola. Yes, it is still quite deadly, but we do things like supportive care. That's the foundation of treatment, regardless of the strain, right? What does that mean? That means giving fluids. That means replacing electrolytes, that's salts and minerals and things like that. That is trying to treat nausea and fever, giving antibiotics and antimalarials in case there may be an other infection happening at the same time. Not to treat Ebola, because Ebola is a virus, don't forget that. But there may be other things that we are also concerned about. Patients may also get oxygen support, blood pressure medications, dialysis. The list goes on and on and on. Remember, this can be a very severe disease, so often the treatments for someone who is sick is very, very intense. Now, there are 2 specific drugs that have been developed, but the catch is that they only work against the Zaire strain, which again is the most most common strain. Now, this is great that we have these couple of medications for the Zaire strain, but the issue is for the other strains, right? The other strains, these drugs don't work. Scientists are testing new treatments. We are studying this, but right now we don't have any that have been approved. In terms of vaccines, there is a vaccine, but just like the drugs that we just talked about, it only protects against the Zaire strain. Thank goodness we have that, right? But we also want vaccines against other strains as well. Those are also being tested, but listen, we need this right now. Public health measures in this situation and vaccination, and when possible, is so important, right? So you want to find, from a public health sort of standpoint, we want to find people who are sick quickly. We want to isolate them. We want to do contact tracing. You guys heard about this with COVID. We want to do other protective measures in the community, etc. And community trust and education are important as well. There's a lot more to say, but I hope this is a helpful start. If this video was helpful, please subscribe. Please follow me on Facebook. Please subscribe to my channel on YouTube. I'm on Instagram, TikTok, LinkedIn, etc. Please follow my health content. I also have a free weekly health newsletter at drjencaudle.com. Please subscribe to that as well.